So somebody asked me a unique question, and Cherokee, this goes out to you. This is the answer to your question. What is medical like for the homeless? Like, what kind of things should you expect? Things along those lines. So, depending upon where area of the country you're in, what the local resources are, will be a big part of what your access to medical care is. Medical care has gotten a lot better for the homeless than what it used to be. It would be rare if you ever came across free medical care. You generally had to go to the emergency room, get a bill that you couldn't pay, and just keep going back to the emergency room if you needed to. But as I guess Obamacare is probably what made the big change. With that happening now, the homeless have a lot more access to medical care. And you may be asking, well, do I get Medicaid or do I get Medicare? Medicare is for people that are on disability, and Medicare is also for people that are like collecting SSI, like they're 62 or 65 or older. Okay, so those are the two ways in which you get Medicare. Medicaid is what poor people get because you can't afford your own insurance. And there is a lot of things that are a little bit different compared to even getting Medicaid, because you don't even really want to get Medicaid out here. So for example, in Florida, as long as I'm not getting Medicaid, the government will actually pay for your health care. And so I got Blue Cross Blue Shield, so I could go in and I got a HMO, so I don't get to choose my doctor per se, other than my primary care physician. But I get prescription benefits, all that good stuff, like you were getting regular health care. And so that allows you to be able to take care of yourself a little bit better. Versus Medicaid, you're just on the government program. They don't pay for a lot of things. They're not going to do any preventative medicine. It is mostly for you to take care of you after you've already kind of crap's already hit the fan. Mostly people that are about ready to get on disability are generally on Medicaid before they go on to Medicare. At least that's the way it used to be. But Medicaid in a lot of ways is on its way out, because these private health insurance companies are now getting paid from the government through the marketplace, that allows you to go out and actually get a little bit better care than what you would get from Medicaid. Because I knew a lady back in Oregon that if she had cancer, Medicaid wouldn't kick in until it was stage 3. Once stage 3 comes, it's pretty much fatal at that point. And so all they're doing is just to make your last few days comfortable. They weren't really there to help you deal with it, because she got diagnosed early on with breast cancer, and Medicaid wouldn't do anything until she hit stage 3. When she hit stage 3, they were starting to talk to her about making her final arrangements, and that's really what it's like getting on something like Medicaid versus getting on something like the free healthcare that they offer. And there is this thing going around, I'm sure you hear it on YouTube a lot, about like the $6,400 benefit. Now, you do get part of those benefits that will help you offset your food costs. You get to buy medical supplies and things like that. So even if you're a poor prepper, this is something that you might want to consider doing for yourself, as far as going out there and getting the free healthcare. Now, they usually hang out around homeless shelters. I'm not going to tell you some of the other stuff that happens with them, because I don't want to get the people in trouble. But there's some things that they're doing that technically it could void just about every single contract out there. Okay, but as far as going and getting the care and getting the care that you need, there is a lot more access to medical care. Now, you have an issue like here in Cincinnati. Dental care is kind of like the laggard. It's the one thing that you're really not going to get good care for. So like when I was here and I wanted to get my abscess lanced and have them take a look at it, well, they said, well, you guys show up at 7 o'clock in the morning, and usually everything's already full, because dental care, especially with the homeless, that's probably the number one care that we need, more than the medical care and the prescription cares, because and they were finding out way back in the day, like 15 years ago, they were talking about if you didn't have dental care and you didn't take care of your teeth, the insurance companies would actually raise your premium, because they found that people that did not have good hygiene as far as taking care of their teeth falling out, kind of like how mine are going to have way more health problems because of the just the way that your mouth and the rest of your immune system is interconnected. And I mean, they never really push that, but it would be nice if they would do something similar to that, because then that would mean that we could get better dental care. So if you just need regular medical care, go see your primary care physician. Maybe you need certain medications, stuff like that. The free health care that they offer is going to be something that you want. Medicaid, that's only if you can't get the free health care. Okay, and there are ways that will bar you from getting it, but that is just one thing for you to consider. And then of course Medicare, but Medicare is something that is a different beast. So if you are on Medicare, okay, not Medicaid, not the free healthcare, but Medicare, okay, because I used to be a health, life, and annuities agent when I was in Florida. We did a lot with turning 65. I sold a lot of Medicare supplements, and one of the things that I learned as a rule of thumb is that if you are what they call a Medi-Medi, which means you're getting not only Medicare, but you're getting Medicaid. So there are people that are just that poor, especially with disability, that get both Medicare and Medicaid, because Medicare only covers the first 80% of whatever the bill is. So if the bill's $1 million, you owe 20% of that $1 million. There is no cap on it when it comes to Medicare. Okay, that's where Medicaid actually comes in and kicks in for the poor people, especially those that are on disability. Okay, but with being on Medicare and being on Medicaid, you qualify for something that's called a Medicare Advantage plan. Okay, so a Medicare Advantage plan is a lot like the free healthcare that they're offering the homeless. So you go through a private insurance company. So what happens is you get unenrolled from Medicare and you get enrolled in this private health insurance company. And so the government actually pays about $800 a month for your I think it was a Part B, which is your 80/20. The government pays $800 a month for that insurance. Well, they take that same $800 a month and they put it over into the Medicare Advantage plans. And it's almost like you're getting Cadillac insurance, but that's if you're poor. If you make, let's say, less than like $50,000 a year, okay, as a retired person. If you're making over that, you want to look into something like a Medicare supplement plan. Back in the day, we did the N, which was you paid one premium, and when it came to the 80/20, the insurance company covered the 20%, so all you had to pay was just your premium, and you didn't have to pay anything else. Okay. Now, I'm not a licensed insurance agent anymore. I'm telling you about my experience. You need to consult an insurance agent, and I strongly recommend having a personal agent. Have somebody that's going to come out, sit down with you, have a talk with you, look at all your options, see what is going to work for you, versus just calling those 800 numbers, because those 800 numbers, you're not going to get taken care of very well. It's just having a personalized agent, even if they just check in with you once a year to see how you're doing, is so much more important. And even that's part of the reason why I do the free healthcare versus getting the Medicaid, is because I get an actual agent that reaches out to me. So as my lifestyle circumstances change, which means I make more money, I make less money, then I can change my plan. There's going to be, a monthly premium that I may have to pay due, but I'm still getting subsidized by the government. So these are some things that you can consider when being homeless and being out here, because everybody's situation is different, and your situation is going to be unique to you. But those are going to be essentially your 3 or 4 options that you have available if you're homeless and are looking at healthcare and what kind of healthcare you would like to get. Okay, again, if you're just homeless and you're still of working age, go with the free subsidized healthcare. If you're a Medi-Medi, go with a Medicare Advantage plan. Otherwise, go with the supplement. But and if you are a veteran, because I know a lot of these places will try and unenroll you from your veteran benefits. Do not give up your veteran benefits. Those are the best benefits you will ever get. Do not give them up. I actually had to undo what a previous agent did. So this guy was retired Air Force, and so he got TRICARE for life, but they came in there and put him in a Medicare Advantage plan, and it's like, no. Your TRICARE is the best health care that you can possibly get. My old man has it, and if it wasn't for TRICARE, his medical bills would have broken him otherwise. So just something to think about if you're a veteran. Make sure you stay on your veteran benefits, because those are better than anything else that they offer out here. So anyways, you guys know how to help the channel. Become a subscriber. Everything else is down in the description. Thanks for watching. See you in the next video.